Welcome to St. Elizabeth Healthcare, and thank you for choosing our team for your orthopedic surgery. Total joint replacement is considered an elective surgery, and therefore we have the luxury of being able to help you plan beforehand and provide you with all the information you need to have a successful surgical outcome. The goal of this education is to teach you how to properly prepare yourself, your home, and partners in your care for surgery. We want to ensure that you fully understand what to expect through all phases of a total hip replacement.
To ensure your safety, you will be required to complete the pre-admission testing process no later than 7 to 10 days prior to surgery. As a part of this process, a complete health history will be obtained, as well as the completion of testing ordered by your surgeon. This appointment may be completed remotely via telephone or in person, based on your current health status and physician preference. At this appointment, you should be prepared to provide a listing of any medication you are taking. This includes any prescriptions, over-the-counter medications, vitamins, and supplements. If easier, for in-person appointments, you can bring your medications with you in a Ziploc bag for review. The nurse will advise you regarding the medications you should continue taking, what medications to stop, and when to stop those medications. It is very important that you follow these instructions. Medications not appropriately discontinued have the potential to cause your surgery to be canceled or delayed. The pre-admission process typically takes about 1 hour to complete. If you see a specialist for other conditions, for example, a cardiologist, your surgeon may ask you to visit that provider as well to obtain their clearance for surgery. It is important to know that if you have had any recent dental infections, you should notify your surgeon for direction. It is also advised that you provide a listing of anything that you are allergic to, whether food or medication, during the pre-admission testing discussion.
Now that we've gone through pre-admission testing, let's focus on preparing your body and home for a smooth recovery.
Exercise. Prior to having a total hip replacement, you should continue to exercise as much as you can without causing your body additional pain. Staying mobile will help with your flexibility as well as endurance and can result in faster recovery. The following exercises are recommended before surgery to strengthen your leg and hip muscles. Terminal knee extension. Lie on your back with a firm pillow or large towel roll under your weak leg. Slowly lift your foot upward. Your knee should remain on the pillow and your leg should be as straight as possible. Hold this position for 5 to 10 seconds, then slowly lower your foot back to the starting position. Repeat this motion for 10 to 15 repetitions, 2 to 3 times per day. This exercise works to strengthen your thigh muscles or quadriceps. It helps to build strength, improve range of motion, and prepare your body for a smoother recovery after hip surgery. Hip abduction, adduction to neutral. Lie on your back with your legs straight. Slide your weak leg out to the side. Keep your knees straight and your toes pointing upward. Do not lift your leg, just slide it. Ensure your hips are level and do not shift or tilt during the exercise. Additionally, you will want to keep your back in a neutral position with no excessive arching or rounding to prevent strain or discomfort. Repeat this motion with a slow and controlled motion for 10 to 15 repetitions, 2 to 3 times per day. This exercise works to strengthen your hip muscles. This can significantly improve your post-operative recovery. Ankle pumps. Pump the foot back and forth to increase blood flow to the calves and to help prevent a blood clot. Ankle pumps may be done from either a sitting or laying position. Think of it as pushing down on a gas pedal all the way to the floor and then bring it back up as far as you can. You should feel your calf muscle contracting, similar to how it would if you were walking. Repeat this motion for 25 repetitions 4 times each day. Ankle pumps are crucial for preventing blood clots and reducing swelling, which are common concerns after hip replacement surgery. This exercise should be completed both before and after your surgery. Quadriceps set. Lie on your back with your legs straight. Tighten the muscles on the top of your thigh by pushing your knees down into the floor. Hold each contraction for 5 seconds and repeat for 10 repetitions, 2 to 3 times per day. The quadricep muscles are essential for hip extension and regaining the ability to strengthen your leg after surgery. Quad sets can also be completed from either a sitting or laying position. Gluteal set. Lie on your back with your legs straight. Squeeze your buttock muscles together and hold for 5 seconds, and repeat for 10 repetitions 2 to 3 times per day. The gluteal muscles help to keep the blood moving in your hips and legs. These exercises further help to strengthen the hip and buttock muscles, which are important for stability and recovery after surgery.
Diet. Proper nutrition is key to healing after surgery. Let's go over the foods that will help with your recovery.
Maintaining a healthy diet is important for your body prior to surgery and for your recovery from surgery. Your body's muscles and bones require good nutrition to heal. The following nutritional tips are recommended. High protein consumption is vital to rebuilding muscle after surgery. High protein foods, such as meat, fish, and dairy consumed in the weeks prior to surgery, can provide essential fuel to the body to support the healing process and prevent infections. Vitamin C can help with inflammation as well as with the absorption of iron, which also promotes wound healing. Foods high in vitamin C include broccoli, tomatoes, citrus fruits, and kiwi, amongst others. Increased fiber intake is important to combat constipation, which is a known side effect of pain medication. Stay hydrated. Patients who are well hydrated, excluding in the 2 hours immediately preceding surgery, can have less pain and have been known to do better after surgery. Patients who are dehydrated may experience post-operative complications. Finally, have a plan for your meals after surgery. Perhaps have nutrition shakes on hand or prepare some meals ahead of time and have them ready to go in the refrigerator or freezer. Your body will need good nutrition to promote healing.
Get your home ready. Setting up your home ahead of time can make recovery safer and more comfortable. Here's what to do before surgery.
Have a plan for your pet or pets. Upon arrival, at a minimum, your pets should be placed in another room until you are seated and your hips safely protected. You do not want your pet jumping on you and knocking you down or risking additional injury to your hip. Additionally, you will want to minimize contact with your pets immediately after your surgery, especially around your incision. You will want to use a chair with 2 arms when you return home, so you can push off the arms to stand. Rocking chairs, low or overstuffed chairs, and sofas should be avoided. It is best to have a plan and have your space set up prior to your surgery, with frequently used items where they can be easily reached. Remove all throw rugs and items from the room that present a potential fall hazard. Things like coffee tables, plants, baskets, pet toys, etc. Install a handrail anywhere you have 3 or more steps. Install a safety bar anywhere in your home where it might be awkward to maneuver. These are not just for the bathroom. It is advised that patients stay away from those which adhere via suction cups, as they will not hold your weight and are generally unreliable.
Establish a partner in care. Having support after surgery is essential. Let's talk about why a partner in care is so important and what their role will be.
It is important that you have a designated partner in care who is an adult 18 years or older. This individual should accompany you on the day of surgery and remain on-site and available for contact throughout your surgery. It is recommended that they bring their cell phone so we can contact them throughout the surgery experience. He or she is encouraged to be present when the RN reviews your discharge instructions in order to assist with any questions you may have later. They should stay with you the first 24 hours after surgery and assist in the coming days. It is recommended that you have assistance for 5 to 7 days after your surgery. If you don't have close family or friends in the area, at least have a neighbor check on you a couple times a day. The longer you can get assistance with things like dishes, laundry, garbage, and pets, the better it will be for you so you can focus on your recovery and getting your strength back.
The day before surgery. The day before surgery is an important time to prepare, both physically and mentally. Next, we'll go through what you need to do to ensure you're ready for a smooth procedure and recovery.
It's normal to have anxiety and be apprehensive prior to surgery. There are several things you should do to prepare the day prior to surgery, including take a full bath or shower and wash with Hibiclens as instructed. This should include washing your hair to reduce your risk of developing an infection after surgery. You should not shave your operative leg for 5 days prior to surgery. This is done as a precaution to help prevent surgical site infections. We recommend drinking 1 bottle of Ensure nutrition drink, Glucerna for diabetics, before going to bed the night before surgery. This can help you feel less hungry in the time frame when you're not able to eat prior to surgery. It has also been shown to help with recovery after surgery. Do not eat anything after midnight. Do not smoke or chew tobacco or use recreational drugs. Smoking increases the risk of complication and can hinder a patient's recovery. It is recommended that you stop smoking 4 to 6 weeks prior to your surgery. Avoid all alcoholic beverages for 24 hours prior to surgery. Follow medication instructions as directed by pre-admission testing. Try to get a good night's sleep and be well rested for your surgery.